As we become more culturally diverse, nurses need to be prepared to provide culturally sensitive care. We know for a fact that culture is a strong aspect of people's lives. It influences one's views, values, and approach to healthcare. But despite of our differences, at the end of the day, we have one thing in common, and that is we all get sick, which we need healthcare assistance. And for today's episode of the Nurse Lounge, we will be discussing Madeleine Leininger's Sunrise model of transcultural nursing theory.
Welcome back to another episode of the Nurse Lounge. Another episode and another stories of the nursing life. For this episode, we will be focusing on transcultural nursing. I've heard that we invited a special guest. So partner, what are we waiting for? Let's welcome our guest.
Yes, partner. Each person holds unique values and cultural backgrounds. Yet, ultimately, we share a common experiences. Everyone faces illness at some point and requires healthcare support.
To provide us knowledge and appropriate care in line with transcultural nursing, let us all welcome our transcultural nurses, Miss Jenica Castardo and Miss Eliza Diaz, to share with us about Madeleine Leininger's Sunrise model of transcultural nursing theory.
Welcome to the Nurse Lounge, Miss Jen and Miss Eliza.
Good morning, everyone.
Miss Jen and Miss Eliza, can you please introduce yourselves to our audience?
Yes, and first off, I would just like to thank you for inviting us here today. I am Jenica Castardo, and I am a transcultural nurse for at least 20 years, and I am really excited to impart my knowledge and experiences and stories about transcultural nursing. Well, specifically to my favorite theory of Madeleine Leininger, which is the Sunrise model of transcultural nursing theory.
Hello everyone, I am Eliza Victoria Diaz and I have been working as a transcultural nurse for 18 years. Thanks for having me here.
Yes, thank you for granting our invitation, Miss Jen and Miss Eliza. So we have here sets of questions frequently asked by our audience in our social media platform about Madeleine Leininger's Sunrise model.
Okay, so let's get started. Here is the first question. Who is Madeleine Leininger?
Well, who is Madeleine Leininger? Well, to begin, Madeleine Leininger was a pioneering nurse theorist who developed the transcultural nursing theory, emphasizing the importance of understanding about cultural differences in healthcare. Well, Madeleine was born on July 13, 1925 in Nebraska, US of A, and died on August 10, 2012. She earned a PhD in anthropology, in which she blended nursing and anthropology in her theory. So her theoretical framework is depicted in her model called the Sunrise model, and that she introduced the term transcultural nursing in around 1950s, and that she believes that culture influences the perspective of individuals about the health, about the illness, and about the care. So overall, Madeleine emphasized that nurses must consider and understand cultural factors in providing effective care.
Yeah. If you are in nursing, I know that you have heard about Leininger. So for the next question, what is Madeleine Leininger's Sunrise model of transcultural nursing theory all about?
Okay, so Madeleine Leininger's Sunrise model, a part of her transcultural nursing theory, it focuses on providing care that is culturally sensitive and aligned with the patient's values, beliefs, and practices. So the model visually represents the interconnected factors that influence a person's health and cultural care, including cultural values and beliefs, religion and spirituality, socioeconomic factors, education technology, politics and law, kinship, and social structure.
So for cultural values and beliefs, these are the core principles and standards that guide behavior within a culture. While they shape how individuals interpret health, illness, and healing. For example, some families or some cultures may prioritize family decisions or involvement in health decisions, while other families, however, focus on individual autonomy.
Yeah, I think in Filipino culture, most of us consult first our families before making big decisions.
Yes, that's true. And for the religion and spirituality, well, religion often influences a patient's health practices, including, well, the dietary restrictions, including the prayer, rituals, and beliefs about illness and healing. Spirituality, on the other hand, can also impact coping mechanisms and the search for meaning in health experiences. So, recognizing and respecting these elements can foster trust and improve patients' outcomes.
That's why part of patients' data or chart is knowing their religions. Because just like for Islams, there are haram practices like eating pork.
Well, that's right. And to continue, the socioeconomic factors. So these include income level, the occupation, and access to healthcare resources. Patients from, lower socioeconomic backgrounds may face barriers which is undeniable, and it's a reality, such as inadequate healthcare access, poor living conditions, and limited resources for health promotion.
Exactly. Considering socioeconomic factors enables nurses to advocate for the necessary care and support they needed.
Just like the patients from public hospitals, some of them have limited resources for health promotion. That's why healthcare is their least priority.
Well, I couldn't agree more. And also, one of the factors of cultural preferences is education. Well, education level affects health literacy, which influences how patients understand health information and make decisions about their care. Higher education levels are often associated with better health outcomes, and we all know that. While nurses should assess a patient's educational background to tailor communication and education strategies effectively.
In technology, this encompasses the availability and use of medical technology, information systems, and health apps that can really impact the healthcare and delivery and patient engagement. In terms of politics and law, political factors and legal regulations shape healthcare policies, access to services, and the rights of patients. Nurses must be aware of the legal context within which they operate, including patients' rights, consent laws, and healthcare policies that may affect their practice and their care provided. Lastly, for kinship and social structure, this refers to the relationships and support systems within families and communities. Social structures can influence caregiving roles, decision-making processes, and the support network available to patients.
Yes, I have read that recognizing these relationships helps nurses involve the right people in the care process and understand the social dynamics at play.
Yes, that's true. Overall, the Sunrise model helps nurses assess and integrate these cultural elements into patient care, ensuring it's culturally congruent, thus promoting better health outcomes and patient satisfaction. The visual sunrise design symbolizes the integration of these various cultural factors into the care process.
Wow, you guys are really experts in this. I agree with you, partner. So here's another question. Can you give us a brief or summarized understanding of the sunrise model diagram?
Yeah, sure. Actually, we have prepared a video presentation about the sunrise model diagram.
So for today, we are going to explain the levels of the sunrise model. For the level 1, we have the worldview. It represents the overarching beliefs and perspective of a culture. It shapes how individuals interpret health and illnesses. And for their relation, it influences cultural values and behaviors that guide health decisions. And for the level 2, we have the multifaceted person affected by different factors. It means that acknowledges that individuals are influenced by various elements, including cultural values and beliefs, religion and spirituality, socioeconomic factors, and kinship and social structures.
Next level, which is level 3, our health, where it focuses on the individual's overall health status, encompassing physical, mental, emotional, and social well-being. In relation, it's shaped by worldview and multifaceted influences affecting how individuals cope with illness and engage with healthcare.
For the focus is on individuals, families, groups, communities, or institutions within diverse health contexts, emphasizing that care is not one size fits all but tailored to cultural and social backgrounds. For the care practices, this section differentiates between generic care, nursing care practices, professional care practices. For the generic care, it is the traditional or culturally specific care practices. For the nursing care practices, it is about professional care provided by trained nurses. And lastly, for the professional care practices, it is the evidence-based clinical practices typically provided in healthcare setting.
Leininger proposed three main nursing actions for culturally competent care. First is the cultural care preservation or maintenance, supporting cultural practices that are beneficial to health. Example is that a nurse allows a patient who finds comfort in prayer to pray before surgery, as it promotes emotional well-being without interfering with medical care. Second is the cultural care accommodation or negotiation, adapting care to meet cultural needs while ensuring health needs are met. Example is that a nurse caring for a patient who prefers vegetarian food arranges a vegetarian meal option in the hospital, ensuring that the patient's dietary preferences align with their health requirements. Third is the cultural care repatterning or restructuring, modifying harmful cultural practices to improve health outcomes. Example is that a nurse educates a patient who adds too much salt to their food, suggesting herbs or spices instead to maintain flavor while lowering blood pressure.
So overall, this diagram emphasizes that effective nursing care requires an understanding of cultural influences on health and illnesses, leading to culturally congruent care strategies that respect and integrate the patient's cultural background into their health care.
Wow, that is a nice video presentation. Yes, I'm sure by now our audience learned something about the sunrise model. For now, I've heard that you guys also invited a guest with real-life experience about transcultural nursing. Is that right?
You're right. Well, in order for us to fully grasp the concept of Leininger's sunrise model, we invited Miss Camille to share her story on transcultural nursing theory and how is this being applied to a real-life setting.
Okay, let's have our guest when we come back here in the Nurse Lounge. Welcome back to the Nurse Lounge. So we have another guest here, Miss Camille. Welcome to our show.
Good morning, everyone. Thank you for having me.
So Miss Camille, will you share to us your story?
Of course, I would gladly share my experience as a nurse that's applying the transcultural nursing when I encountered a patient who is a Jehovah's Witness.
Nang, lapsit na kay ka. So, ang halali na. Tawag na doktor o nurse na. Lapsit na kay ka.
One time, I had a 10-year-old patient
who experience hypovolemic shock and in need of blood transfusion.
Good afternoon po. Ma'am, so according po sa doktor, kailangan na po talagang sarina ng dugo ang anak ninyo.
Hala, miss. Global hospitals man, miss. Bawal man sa mo ang magpasalid ng dugo. Wala na ilain. Kinahanglan mo haton para maayo ako ang anak.
Ma'am, nag-hypovolemic shock na po kasi ang anak niyo. Ibig sabihin, kulang na po ang dugo sa katawan niya, kaya kulang din po ang oxygen na nagadaloy sa katawan niya. Pag napabayaan po natin to, pwede po maglala ang condition niya and much worse po, baka po mamatay po ang anak ninyo.
Ay, hindi po talaga ako magpayag, miss. Dili ko tumusugot ana, miss. Kay bawal maguna sa mga practice sa Jehovah. So, dili, Jul, bisag sa mga itabo.
Okay po, ma'am. Respect your decision po. I-inform mo lang po namin si Doc po, tapos may papirman po ako na waiver po sa inyo.
Okay po.
Thank you, ma'am.
To respect the patient's religion and belief, the guardian signed the waiver that they refuse the treatment despite of being informed about the risks and benefits.
And another is when I encountered a patient who is a Roman Catholic who requested a chaplain for her spiritual healing.
Ma, iampo, jud ko na ka. Opo, ma. Kung pwede lang jud ko manawag o pare diri ron.
Ma'am, kung gusto niyo po, pwede po tayo mag-request ng chaplain po or pare para po manoy po natin si ma'am.
Pwede din na, nurse?
Yes po.
The patient's daughter requested for a chaplain to fulfill her mother's wish to be anointed.
Salamat jud kayo, ma'am, ha. Salamat jud kayo, father, ha.
You're welcome po, ma'am. Happy din po ako na natupad po yung wish ni ma'am na magpa-anoint po.
Thank you for sharing, Miss Camille. As much as still we want to know more, we really need to end this episode as we're running out of time. But before we end, I would like to ask our guests to give us some advice or tips to our audience in giving healthcare.
So my advice is you should always remember that in giving care, we must embrace cultural awareness and assess patients holistically by fostering open communication about their cultural preferences.
And additionally, we have to integrate the principles of Leininger's Sunrise model into the practice, which fosters culturally sensitive care, improving patient outcomes and experiences.
Thank you for being part of today's episode.
Thank you for the invitation.
This is the Nurse Lounge, where nursing stories that inspire are unveiled.